we have extended this screen, right?
Hmm.
Yes, sir. No option is coming for the this one color. Just a minute, I can try once if possible is there. हाँ, this night mode is
अभी ठीक है?
हाँ, this one better ना sir. Okay, it I have to save ना, no save. Duplicate करूँ?
नहीं, जो पहले आ रहा था ठीक आ रहा था ना.
जी.
Duplicate will be
Same screen will be visible.
no, here I think. No, आप वही करिए ना, extend will be better ना. The slides will be coming, right?
Yes. Mic is on. Microphone is on. Okay.
Okay. Excuse me. It's not showing.
Sir, you have kept it on the extended mode, no? So this is the primary screen and that is secondary mode. So I am asking to
अच्छा,
keep on the
हाँ,
this
कर
one.
दो फिर.
Windows P, keep on duplicate. Okay.
Control क्या बोला आपने?
Windows P. This one. Now the visibility is clear, no? Color.
Okay.
Sir, is three handle mic. So microphone is there.
Okay. मेरा.
यूल की भी और नहीं किया था ऑलरेडी या कैसे?
हाँ, ठीक है.
अब मैं एक पीपीटी भेजता हूँ.
हाँ.
वो मेरा सेशन है, उसको बीम करना पड़ेगा. मेरे को मैं टीम्स में भेजता हूँ. नेट चालू है.
हाँ, एक मिनट ना, ये मैंने ना
बेटा रूपल टेक ओवर. ठीक है, मैं टीम्स में भेजता हूँ. थोड़ा 10 मिनट में, मेरा बाद में ही है सेशन.
तो ओपन कर लेना, यहाँ पे खुला हुआ है.
टीम्स ओपन है.
देखिए, मेल कर दो, मेल ओपन है. टीम भी ओपन है.
discuss the potential of 5G, robotics, IoT drones, and leveraging the emerging technologies for public healthcare services. Now, I request Ms. Anna Roy, ma'am, to come and give the inaugural remarks and open the session.
Good morning. My name is Anna Roy. I'm Senior Advisor in Niti Aayog, heading the vertical on data and emerging technology. Today's workshop is essentially to interact with the stakeholders so as to lay down the way forward on how we can mainstream new technology in promoting and making a more robust public health infrastructure in the country. So with that goal, we have a very good group of people. We have policymakers, we have regulators, we have startups, we have big industry, and we have a good, very good representation of Niti leadership. To begin with, I would like to introduce some of the key people who will be participating today. We have Dr. Vinod Paul, who is member health and leading everything relating to the health sector in the country. Thank you, sir, for taking out time and coming all the way to Mumbai. We have we will shortly be joined by Mr. Rajiv Bansal, Secretary Civil Aviation. From Department of Technology, we have Mr. Sanjeev Agarwal, who is a member in 5G Committee of Department of Technology. From the other stakeholders, we have Mr. Sharat Sharma, who will be representing iSpirit and handling the technical aspect of it. For the drone session, we have a very big team from World Economic Forum. Vignesh is there. Of course, Purushottam Kaushik, sorry, we all call him Puru, so the full name was just, I was just missing it. So Purushottam Kaushik is overall WAF, drone plus other health sector things. But the drone thing in WAF is being led by Vignesh. For the post-lunch session, we will be joined by several representatives from the industry who will be presenting some of the technologies. The most important part for today's deliberation is the representation from the state government, because at the end of the day, the central government can come out with policies, regulatory measures, but it is the states which is the hub where we have to kind of, make sure that these technologies are embedded. And I welcome all these state representatives who have taken time to travel all the way to Mumbai and join in today's deliberations. The purpose really is to make it an interactive session. We don't want to have long speeches, one-sided speeches, and we have kept time for open houses, so please feel free to share your views. That is the ultimate goal of today's workshop. At the close of the day, Dr. Paul will be kind of summing up the deliberations and giving a way forward where it would comprise of various policy interventions, regulatory interventions, as well as other institutional interventions which are required for mainstreaming emerging technologies to improve our public healthcare system. So with that, I would request Dr. Paul to kindly deliver the keynote for today's session.
Namaskar. Good morning. Very warm welcome on behalf of Niti Aayog. Respected Shri Sanjeev Agarwal, sir. Distinguished colleagues from the state governments, colleagues from the Indian Council of Medical Research, other arms of the of the Government of India. Above all, our partners, ID Spirit, World Economic Forum, GEO, and really above all, the community of startups, innovators that has joined today in this hall this morning. Truly grateful to you for coming together. As my colleague, Ms. Anna Roy ji has explained, the purpose is to have a churning around priority technologies and to find pathways to translate the potential into sustained action, sustained reality. Having technology alone is multi-sectoral to begin with, but to take technology and translate that into service delivery, change in life of individuals, and so on, requires many partners along this chain. What we are trying to hope and do this today is to look at that pathway very systematically and create a pipeline which is seamless, one team pipeline of all the players, innovator, private sector, government, community, regulatory system, different arms of the government, state governments, other players. That's what we're trying to. It's a thinking meeting, it's a melting pot today. And we've taken two broad areas, but by extension, the same paradigm in terms of finding such pathways applies to other technologies as well. And that's why a certain, this group has been convened. First and foremost, we would like to know, as we move, particularly for drones, particularly for 5G, but by extension, other technologies such as point-of-care diagnostics and so on. What is it that's potential, and IT use, and AI use, and so on. कोई लिमिट नहीं है, दो खास तरह से फोकस कर रहे हैं बिकॉज उसमें हमें प्रैक्टिकल एक्शन, थीमेटिक एक्शन एरियाज हमने आइडेंटिफाई करने हैं. बट बाय एक्सटेंशन we believe the process is the same. What is it that is there on the horizon? Potentially. And India can take lead. India must take lead in these areas. We must be the nation to look up to for emergent technologies for healthcare. It is our destiny. It is our destiny. And we should lead it. We already lead in many, many ways. And you are aware of that. But I think to really make technology use as a way of life is the path that we must fully facilitate and fully deliver on that. So what is there on the horizon? Possibilities क्या हैं? हम सबसे पहले उनमें भी लगें जो कि इस पॉइंट पे हैं rather than यहाँ पे हैं या यहाँ पे हैं. हमें ये भी सोचना, हमें आपसे ये सुनना है. Second issue is, in order for us to demonstrate the technology, the first step is demonstration. How do we create? How do we adapt? How do we refine? How do we work together to make it the most relevant? And then, how do we test it in real life? In a primary health center, in a remote island, in a busy hospital, Safdarjung Hospital, AIIMS, other hospitals next door, in mountainous locations, in home settings. A lot of healthcare is moving toward home care, care of the elderly, care of many diseases, enabled by telemedicine, for example, particularly through that. But even otherwise, care is moving to homes. How do we adapt that path? For one technology, there will be many, many pathways and many, many points of delivery. How do we do that? And third is, How will that become a way of life as part and parcel of the program? Potentially. That's in the clinical trial, we call it effectiveness level of studies or implementation science, implementation research. And then above all, how do we ensure that that technology is then finally embraced by the public health system and the private health system, as the case may be, and becomes part of life? For that, I just want to mention, and starting from that end, that the Ministry of Health and Family Welfare has set up what they call a single window vertical for startups on hand-holding, partnership, incubation, and absorption of these technologies. So there is an effort out there to which we will ultimately plug a ready technology कि आप ये शुरू कर दीजिए. अब हम ये मान लीजिए कि we have a 5G enabled technology which can look at the ear, which can look at, let's say, can do refraction, make it a way of life in all our 140,000 health and wellness centers. Now that is the final outcome, the day we will really celebrate. Endpoint. And then we move on to something else. So these are the multiple steps, and perhaps there are other sub-steps within that. But one of the core issue and a problem has been that the innovators, typically engineers, typically the people who have grasp of these technologies, visualize a use case, they build a technology around it, and they make early proof of concept. And by this time, already months have been spent, your own money has been spent, and so on. And one gets an impression that I have done it. And you'll come and tell, हमने तो बना दिया, हमने तो लग गया, अब क्या करें? उसमें दो problems हैं. One, that other path has to be understood, but the immediate one is more important. We need to, invention alone, even with proof of concept, is not sufficient for uptake in the health system, particularly for health system. I don't know about other sectors. Unless it has been embraced, used, experienced by healthcare teams. वो तो था ही नहीं, आप तो अपने पास बैठ के बना रहे थे. हमें co-create करना है. After a point, in fact from the very beginning, technology use cases, technology products, shall we say, meant for health must be co-created with the health sector. एक बड़ी advice है startups के लिए. बहुत late आप आते हो. आप बना के बैठे हैं, लेकिन टेस्ट अगर एक न्यूबॉर्न बेबी पे करना है तो डॉक्टर या नर्स तो आपके साथ शुरू से होनी चाहिए. उसको भी क्रेडिट मिलना चाहिए. आप तो इन्वेंटर बन गए, आप तो स्टार्टअप, उसको क्या क्रेडिट? फिर मैं सुनता हूँ कि आप करिए ना, हमने बना दिया है, आपका काम है. ऐसे कौन करेगा? अपनी ज़िंदगी के 6 महीने वो क्यों लगाएगा? ये सोच के चलो. ये स्टार्टअप्स के लिए एडवाइस दे रहा हूँ. शुरू से को क्रिएट करिए और डीप करिए. टीम में 2 स्ट्रैंड होने चाहिए, 2 पिलर हैं टीम के, तब ये घर बनेगा. Inventor, technology, and a person who is belonging to the health sector. It may be an ASHA worker, it may be a doctor, it may be a super specialist, it may be a surgeon, and so on. तो ये थोड़ा ख्याल रखना है. एक तो ये part है. Now, as I said, one of the major issues that I have been personally concerned, and my team has been personally concerned, is that we have a robust technology, but we don't find pathways to test them in real life situation. In implementation science and implementation research, there is a notion of valleys of death. The notion is the following, that there are so many molecules potentially in laboratories in the world, including our own, which are potential cures, let's say, for cancer, for hyperlipidemia or something. Potentially, because in the pathway you can see this is what it does. But that itself doesn't become a medicine. For that molecule to become a formulation, it has to go to a GMP level of production. It has to be tested in animals. It has to be then tested in humans. Phase 1, phase 2, phase 3. And then somebody has to be ready to manufacture this on scale. So you need an industry partner. And then there's the regulatory issues. This is a long path. So what happens is that you have the molecule, but it doesn't reach the patient or my father at home. And this whole gap is the valley of death because of a missed opportunity. Ultimately, you will realize there are multiple valleys because one would be making a connect with the clinician, to which I referred. This clinician then testing, finding budget to get the testing done and ethics clearance. After that industry, after that regulation, हमें इसको ब्रिज करना है. तो एक पर्टिकुलर वैली जो हम ब्रिज करना चाह रहे हैं कि आपके पास टेक्नोलॉजी है. आपने कहा कि 5G बेस्ड वेयरेबल बेल्ट है मेरे पास जो फीटस की मॉनिटरिंग कर सकती है घर में. And based on that, I can get this young mother, 21-year-old, in case there is a fetal stress, within an hour, within 45 minutes for a cesarean delivery, done within the next 3 hours total. It's possible. Technically, it's possible, in one of my wish list idea, right? Now, you want to test it. You have the belt, you have the technology, you have the 5G in this room. How do I test it? Where do I go? That is one area that we want to bridge, we are very clear. So we will work with the Ministry of Health, we'll work with the Indian Council of Medical Research, and we'll create these field sites or hospital sites or shall we say population sites to test these technologies. आपको हमें approach करना है systematically that you have something, can we test it in a setting of, let's say, primary care or setting of a busy district hospital, and we will find a way that we lead you to that. I'll give an analogy how it works. For corona vaccines, already the DBT, Department of Biotechnology, had created vaccine trial sites. This was done 2-3 years ago. It was done after rotavirus vaccine was created in India. After that, multiple vaccine testing sites were created. Now, what did it mean? That we knew in this population, so many young children, so many adults, so many men, women, they are there. There is a hub where there is a statistician, there are researchers attached to a center, maybe a medical college, let's say. And this population estimates are known. Fundamental issues are known. Vaccine storage capacities, like cold chain, etc., are made available somewhere in that population. And then when the vaccines, we didn't know what we will use it for. We would have thought we'll use it for HPV. But then when the time came, these were used for COVID-19 vaccines. Let me be specific. For DNA vaccine on 28,000 individuals, practically all the trials at the population level, 28,000 ka trial kiya unhone during Corona, using these sites. So they came, they plugged, they played. Covaxin ke liye 25,000. Much of the trials were in these areas, maybe some additional ones in the private sector or whatever. We want to create an ecosystem like that you bring technology and then say, I need to test IoT-driven ICU fire preventive algorithms in a busy hospital. And we'll say, okay, here is KGMU Lucknow, very busy hospital, resource poor, but extremely busy. We have an arrangement, we connect you there and you start working. You tell me you have this wearable belt for fetal monitoring. We say, okay, we have 5 sites where all this can be done. Please go there and we'll facilitate that through government funding. That's the idea with which we caught the partners here, and that is the system that we hope to create. So that you can go and test, and there's a facilitation effort. There are partners you'll find who will make this access possible. ये नहीं कि आपने उसको सिफारिश करनी है और फिर उसको कराना है, उसको ढूंढना है. ये हम कोशिश करेंगे कि ये सिस्टम हम बनाएं. What we want to know from you is what would be patients जब आप ये लेके आइए. 5G enabled ambulance where live back and forth advice can be given. Treatment started in the ambulance. Suppose we have to test it in a state, remote Bulandshahr district, where certain real life situation is to be simulated. We'll say we can do it for you. Bring this technology, चलो चल करके दिखाते हैं. हर एक चीज़ वो मैदानता के आसपास नहीं करनी है आपको. वो तो जियो ने डेमोस्ट्रेट कर दिया. रियल लाइफ में, डिफिकल्ट रीजन में, आप ड्रोन करना चाहते हो, तो हम कहेंगे लाहौल स्पीति में आपको हम चांस देते हैं कि लाहौल स्पीति से आप उठाइए और उसको आप मनाली लेके आ जाइए, करके आते हैं। तो ऐसा इकोसिस्टम करेंगे, बिकॉज व्हेन द स्टेट गवर्नमेंट्स बिकम पार्टनर्स, union government becomes partner, and institutions such as ICMR, whose job is to create an innovation research and a research system, we will rise to the occasion. And research, by the way, is not only laboratory science. Research is also how these things work in real settings. We call it implementation research, we call it operations research, community-based research. It's well known, and the methods are also well known. Also, what are the ethics aspects to be taken care of? For some of these, typically, you will need an ethics system where human lives are involved. तो उसका क्या करना, आपको मदद मिलेगी उसमें कि हम एथिक्स कमेटी बना लें, अगर ज़रूरत होगी। हर एक में नहीं ज़रूरत है, आप ड्रोन से यहाँ से उठा के वहाँ, उसमें नहीं चाहिए। बट यू हैव अ डिवाइस फॉर एग्जाम्पल, एंड मान लीजिए कि वी आर डूइंग अ रिमोट optometry of school children. Right? From this end, I'm looking at the eyes of a child in Meerut district and prescribing glasses from here, let's say. Because there could be error and there could be a wrong decision, so you need an ethics system to do it. So we'll create that system, whether it has to be technology-wise or site-wise, that can all be handled. So there are those aspects, and also facilitate you with the regulatory system, and ultimately link it to the Ministry of Health's idea of absorbing these technologies into the program in a systematic way. I believe there are technologies for TB detection, AI-based, but they have not yet become part of our program. But they should. If we know they are our own, they have stood the test of time, why are we delaying it? So those pathways have to be created. Everything is in place somewhere or the other, but the connections are not there. And this meeting is about creating those connections and those pathways. Ultimately, the word is we like to create a system where you come, you plug, and you can play. That's our hope. I just, in the end, want to emphasize the fact that two parts. One, there will be and should be focus on both aspects. One, disruptive technology, which can be useful also in Sweden, or in Canada, or in Australia, or in Argentina. हमें वो भी करना है, तभी leadership दिखेगी, वो भी सोचिए. Secondly, but more important from India's point of view, technologies which change the lives of the poor, those in rural areas, and which generally would also mean technology which help the primary health care. So हम दोनों ही कॉल आपको दे रहे हैं. आप कटिंग एज करना ही करना है, तभी वहाँ पे हमारा देश का झंडा जाएगा. होना ही चाहिए. Our technology should be used in Germany, right? At the same time, we urge you to also think about ideas where technologies can be used in the primary healthcare setting. We had an opportunity to look at a suite created by Geo, where very comprehensive evaluation of the patient can be done at Health and Wellness Center with a lot of decision making through telemedicine and so on. That makes the life easy. Sure, we should do it. There are challenges of screening for cancer. There are challenges for diagnostics all the time. So all that is very important. So think about primary healthcare on the one hand, and think about the highest end solution for the developed nation as well, because that we will also be needing in our hospitals, in our field settings, and so on. Having said that, when we had an opportunity to visit 5G exhibition, sir, that you had hosted, and you kindly invited us, some of the ideas that came up, I'm just listing, but we need a wish list of such ideas, a big one, and then and DOT has thought about even more ideas than what I'm going to share. One is teleconsultation by primary care providers enabled by 5G-powered smart diagnostic devices. I repeat, teleconsultation, primary care hubs enabled by 5G using smart diagnostic hubs. Now, where will this be useful? Health and Wellness Center, mobile medical units, home-based care of the elderly, schools, health camps, disaster situations. Chota example है, just a trigger. Second, advanced 5G enabled ambulance and emergency care. I think we already have the technology. It's a matter of starting to use, look at how it can be done, and create demonstration sites. Prevent fires in hospitals with Internet of Things. This is Anna's idea. We get a lot of fires in summer season in hospitals. कुछ report होती हैं, छोटी मोटी report नहीं होती. ICUs are a place where there is a lot of load on there are machines and there's a lot of electricity load. Can we detect, can we anticipate, and can we prevent fires by putting IoT sensors so that short circuit, increased temperature can be picked up, or at the least, earliest detection is possible. सोचे इसके बारे में. Prescribing spectacles for children with defective vision by teleoptometry. Today, for glasses, you need a very trained person, not a doctor, but an optometrist. And our country has shortage of optometrists for long. 8 to 10% children need glasses. Almost everybody above a certain age needs glasses. Unmet need is huge. तो दूर से कर सकते हैं क्या? If we can do remote ultrasound and technology exists today, can't we do optometry that I can prescribe glasses? Is that possible? This is one of our wish lists. Wearable sensor for home-based monitoring of fetal health among women with high-risk pregnancy. I give you an example. And I have a request from IIT Mandi that they have this interest in this. Teleimaging, you'll be hearing a lot about it. Of course, training of doctors and others using VR, AR technologies, drones for healthcare, and so on and so forth. But the commitment of NITI, or NITI's agreed pathway is that we will create a collaboration. That's what we're trying to do. Make connections and pick up on your ideas, and to create an ecosystem where we generate technologies, we refine technologies, we adapt technologies for our own nation and our communities. We provide you a testing ground where this can be done, and that's a big one from our point of view, and doable, and much awaited, and then ultimately to absorb the technologies into the healthcare system through a certain transparent, structured approach. I pause here and be happy to, then we'll come back in the end to learn and to synthesize a way forward with your help. Thank you very much. Jai Hind.
Thank you so much, sir, for setting the context and for enlightening us about the paradigm of technology and healthcare in Indian context. Now, I would like to invite World Economic Forum India head, Mr. Purushottam Kaushik, to come and tell us about the WEF initiatives in healthcare.
Very good morning. I represent World Economic Forum in India. The center which we have in Mumbai is called Center for Fourth Industrial Revolution, mainly focusing on how 4IR technologies can really be absorbed across various sectors. And the center today, I think this month, or should be completing 4 years now, since 2018 in January, when Prime Minister had gone to Davos, subsequently when came back in October 18, NITI is our host, so this is another good place to celebrate that as well. In the last 4 years, we have really worked across as a more like a multi-stakeholder institution, and today's room is a full representation, as Anna described. Like we have obviously government institutions, we have industries, we have startups, we have academia and research institutions as well. So this is a true representation of what multi-stakeholder, and as Dr. Paul said, house cannot be made on one pillar, it has to be made with the pillars all added up, and that's what we intend to work on. The second big focus has been on the technologies. Now, when we talk of 4IR technologies, for sure, data being the foundation base, we also are looking at how AI, we spoke about it, like how AI could be used for cancer screening, or possibly now the new technologies like metaverse and blockchain, they're going to be shaping up the world. So how 4IR will get adopted in many of these sectors. We have worked across sectors, agriculture, health, urban transformation, education, and now we are looking at circular economy. But let me talk about the health initiative, which we started about right, 2020, somewhere in later part of 2020, when we launched this initiative called First Health, long name. First Health would mean Fourth Industrial Revolution for Sustainable Transformation of Health. And we prepared the whole strategy along with all the industry stakeholders, and we did a lot of consultations. We shared it with the Ministry of Health and also with NITI and Ministry of Electronics and IT, because technology being the pillar. We looked at now subsequently going deeper into the same and have launched First Cancer as a part of First Health. Cancer is a big initiative. We have Mr. Ramkumar from Meghalaya. We announced recently a partnership where Meghalaya is going to be doing a big pilot. It's a population scale pilot, or rather I would say implementation of and Meghalaya will become the first state of using 4IR technologies for cancer care, where there will be 3 big interventions. First one is going to be screening, which Dr. Paul spoke about. Now there is a 700,000 population approximately in the East Khasi Hill district. It's one of the highest cancer incidence rates which happen in Meghalaya, as per the recent reports also, where CM is really worried about. And technologies can be the biggest bridge. So how can we use AI and using maybe either thermal imaging or using ultrasound, and then apply AI on top of it for early cancer detection? Which is just sharing the data, and possibly it should be correct, is around average delay in cancer detection is around 8 months, which would mean much higher casualties and much higher cost of treatment. So that, and plus it's not also a notified disease. So practically we are struggling with the whole challenge in which Meghalaya is going to see. The second intervention is going to be on capacity building, where we have all the primary healthcare workers and also the doctors and hospitals. How do we bridge capacity within the non-oncologist sector? And then we leverage technologies like AR, VR to kind of build the capacity there. And third one, which is one big one, which I was speaking to Harpreet from ICMR as well, that there's a big gap on the data. Now, currently, we are, as an additionally, an initiative where Meghalaya is working with Ministry of Health, and then there is a public health monitoring platform. We are looking at oncology data model to kind of curate the whole data set. So the reason why I gave you all these details is that how possibly 4IR technologies are going to be shaping up future for such an important sector on health. We went deeper into cancer. My colleague Vignesh will talk about how drones are becoming like relevant for delivery of vaccines. Now the pilots are happening, but then it will be used for many other applications as well. Now the reason why World Economic Forum, and I think there was one interesting question came in, what do you actually do? So mainly 3 big focus areas. One is that government, industries, and startups need to find those working relationships. It's called public-private partnership, which would mean government can be a big enabler, not necessarily only a procurer. And startups can really focus on those use cases which can be niche, which possibly needs much more agility and much more adaptation to the local needs, while industries can always be more like a larger product and infrastructure provider. So that's something which we're trying to make it work. And while many of these technologies are really in a different time maturity cycle, metaverse, we can keep talking about it for a few years, but then it will slowly see adaptation in various sides. Blockchain is already a part of many of life. On the maturity of cycle, it needs a detailed level of understanding. Now, similarly, the ecosystems are getting disrupted. We spoke briefly about it, that the existing ecosystems will completely get disrupted because of the technologies becoming a part of it. And that absorption needs to be much softer and much acceptable and it can't be forced. And then the other issues are going to be more like standards, interoperability, biases in the technologies, inclusivity requirements, and finally investments as well. So how these things will shape up and become a part of many of our initiatives. And for sure, today's discussion is going to be on health and focusing on different technologies, getting part of health curative systems, preventive systems, or governance. And we will see how we can really bring all the stakeholders together. So today is an open platform. Welcome you all once again. And let's keep it interactive and keep it going. Thank you, everyone.
Thank you, sir. So in today's workshop, our focus will be on 2 main emerging technologies. One would be scaling up the drones ecosystem for healthcare, and the second segment would be on leveraging 5G technology for public healthcare services. I would now like to call upon Vignesh from World Economic Forum to start the segment on drones.
Thank you. Thank you to all our guests and dignitaries who've flown from different parts of India to be present here today. Special thanks to our partners Niti Aayog who've helped us come to this point in several ways. We'd like to start with how the drone agenda is, and basically today's discussion, actually the outcomes that we envision are more than what the programs have accomplished. We're also looking to make it as issue centric as possible. To see what can be done better, and in alignment with what Dr. Paul said, how can we ensure that we're able to create an enabling environment for more successful demonstrations and then full-scale trials. So our discussion today will be along these lines. We'll briefly touch upon the use cases of drones, deep dive into one of the case studies, which is Medicine from the Sky, identify what the issues at hand are and what some of our learnings were during these coordinated programs, and also outline what questions we would like to have answered today. We do have some great speakers and representatives from state governments who've come from very far away, as well as startups who've been demonstrating the capability time and again for years now. So this is essentially a spectrum of use cases. So come 2020, when the lockdown was imposed, we did see a significant uptake of drone technology, and a pretty interesting landmark is that when lockdown was imposed in March 2020, we were under the UAS rules 2021, which came sometime in April, and before that the civil aviation requirements. So we were sort of aligning ourselves with the policy of the day. But in August of the same year, 2020, when our drone rules were liberalized, the drone ecosystem saw very big uptake. We did see, for example, in Bangalore, streets getting sanitized using drones, by spraying of drones. Several times we've seen thermal sensors being mounted on drones to identify differentials in temperature in crowds. And not very far away from where we are, Mumbai police also use drones to manage crowds while imposing Section 144. And one of the more flagship programs that we did was called Medicine from the Sky, which many of you are aware about, which helped us, bridge gaps, literally actually, bridge this whole valley of death situation and access areas that weren't particularly accessible. So when we initially began this program, the scope included blood, vaccines, samples, and even organs. While of course we haven't reached the phase of organs as yet, and even blood logistics is something that we're working on the sidelines. What we have been able to work on with the help of our partners present here is the delivery of diagnostic samples and vaccines, which started in September. So, as mentioned earlier, the liberalized drone regime has been quite a game changer. Specifically for the state governments present here today, the Drone Shakti scheme that the government of the day announced at the Union Budget 2022 did put in a lot of emphasis on the need for procurement of services. Now, there is a little bit of ambiguity around drones and the hardware at large. And I think the procurement of services will make it asset light. And that's what initiatives hosted by Niti Aayog, which will be discussed later in the day, will touch upon. After the opening up of our opening up of our skies largely, the delivery of vaccines, medicines, and samples kicked off in the state of Telangana, which is of course now graduated to Arunachal Pradesh through this coordinated Medicine from the Sky program. But that said, we're given to understand that at least 14 states have worked on this initiative or trialed it in many ways. So, over and above just the accomplishments, we all have seen a lot of this in social media and in the news about what drones are capable of. We also want to know, what are some of the misses? What is it that, we can focus upon, and what can be improvised as we go forward? So we also have colleagues from ICMR present here today who have also conducted similar programs. And we believe that this whole one umbrella approach will, help us work together and nationalize this program and ensure that, it is coordinated for a pan-India coverage in terms of either a special purpose vehicle or porting of the experts present here into a working group at large. Through the MFTS program, we have drone-enabled around 29 PHCs and CHCs until now. We've touched upon 3 districts. And as per our sort of estimates, we are hopeful to hit about 60 by end of next year. The discussion is open as to whether that's a good number or a bad number, but ideally that's where we want to be. In terms of areas to address, we had 4 specific buckets that we touched upon: perception, infra, operations, and regulatory. These are things that are encountered time and again. Every geography, in the country, every region in India has its own share of issues. We are encountered with different problem statements, due to terrain, due to regulations, due to airspace. So these are things that we would definitely like to touch upon. So I'll give, just in the interest of time, share one example from each. Now, what if a critical PHC is located in a red zone? And how does one approach such a situation? Whom do we coordinate with? Who are the people to talk to? So in parallel with with drone deliveries, it's not a one-man solution where a drone flies from point A to B. There are supporting paraphernalia that we need to get right. So if we are to do that, how do we make how can we create a parallel regulatory regime along with the program of the day that's happening? So that can only happen if we maintain this multi-stakeholder and this coordinated approach, bring everyone to the table. We also invite our colleagues from the DGC and the QCI to come forward as observers who are present here today, to come as observers to see the kind of work that's happening. The infrastructure is, what is the anatomy of a drone hub? How do we classify a PHC or a CHC as drone enabled? Having leveled land, power stations, the general infra of the place. 3 is the perception. So now I think the greatest, one of the biggest things that usually drives such an initiative home is including the local populations, which is something that we've done in the Northeast. And the Northeast, of course, has taken pole position in this sector. But that said, if the locals are engaged, if they are on the right side of the technology and made aware of what can happen, I think the implementation, the adoption cycles can be scaled way faster than they actually are. And one point, of course, maybe a little unpopular, but I'll just say it nonetheless. I do feel that some of the PR cycles that go in parallel with drones tends to set a larger expectation. So how can we manage that? How can we ensure that we make sure that the expectations are in sync with what really happens? So just because a drone sprays pesticides does not necessarily mean we will have a bumper crop in the next cycle. So those things definitely have to be addressed in a big way. And then finally, operationally, because if the biggest beneficiaries of this technology is going to be the healthcare workers or the ASHA workers, they need to be trained on the technology on ground. And we have Apollo Hospitals present here amongst us who's been running some of these training programs for health workers on ground. And if we can, draw that down to a science, build a curriculum out of it, and set up this entire process like a clockwork, then it is only a question of implementation and scale. So a snapshot of what the learnings are: validation exercises is the need of the hour. there is still a little bit of ambiguity around the unit economics. We recently published a Medicine from the Sky report highlighting our Telangana program. We put out the parameters of the economic parameters there, but we did not publish a number deliberately because we felt that we needed more experience and more sorties to be able to arrive at that sweet spot. And finally, streamlines procurement. I think one of our experiences has been that we do a lot of field trials and demonstrations. The startups who are pretty hard pressed on various levels tend to do all of this, quite actively. But when it comes to actual procurement, there tends to be a bit of cold feet. And the reason for that is largely because of the ambiguity around the technology, which we would like a forum like this to clarify. And as mentioned earlier, of course, the regulatory regime to support the nature of the projects that we do, flying beyond the visual line of sight, flying in critical and sensitive areas. We initially defined these stages of graduation, wherein we looked at a 45-day proof of concept, in short, then a 6-month full service demo, which is happening in some of the states, as we speak, and finally scaled up commercial deliveries. Now, this can also be looked at as a roadmap because some states are actually a little early on the adoption cycle, while some states are pretty much advanced. So we expect that today's discussion will help all states come to the same page to a fair extent, take similar decisions, and if some states are embarking on a model of procurement or implementation, we would like those ideas to be shared over here, just so we are all in sync. And I'll just put this out there. This is what we would like to discuss today. Some of the many things, it's not restricted to this, but these are guidelines as to what we want today. We do have an expert group. Everyone here comes with a solid amount of experience in health, in drones and technology. So can we come out with a common statement of purpose, that we can work on together, maybe a sort of special purpose vehicle that we can create out of those assembled over here, led by the government, where we can scale this nationally and also in a very graduated manner. Understand the best, so at least identify a sweet spot for procurement, at least procurement of drones as a service. And finally, address the supply side constraints. I mean, this is a discussion that has done the rounds in drone circles for a long time, as in, are there supply side constraints when it comes to components? If yes, is that translating to a supply side constraint at large? So how do we address that? Is it, first of all, is that hypothesis right or wrong? That's something we need to do. And at the end of it, managing of our airspace. I think 5 years from now, we will have a more crowded airspace. And for that to happen, we need to streamline how we manage it. Right now, of course, 90% of India is in the green zone. But we need to definitely take a closer look to see how we stand and to ensure that there is complete deconfliction from manned aviation and even unmanned at large. And finally, are there any platforms, for example, maybe the G20 or any of the other platforms which can be used for this program to springboard into actionable insights? So largely, we would like everyone here to actually speak up, make it free-flowing and contribute and share your views as to how can today's event translate to actual action on ground. So again, for the sake of repeating myself, I don't want to repeat myself, but I believe that we should focus on issues and solutions more than actually about what we've done. We definitely want a roundup, but ideally we will keep today's session as issue-focused as possible. So I'll leave you with a snapshot of all the stakeholders who are involved in this. Once again, thank you, and we look forward to a good discussion today.
Good morning. So emerging technology, which has a lot of impact for public services, public healthcare, specifically today's topic, would need a market maker, and government presently poised is the biggest market maker, but it can perform this role only if we have streamlined procurement regime, We have seen how a streamlined procurement regime transformed the infrastructure sector in the country. Today, we are seeing highways, airports, ports being built at such a great pace, which we could not achieve for several decades in the past. So, recognizing the importance of procurement, the budget this year announced that drones as a service would be the focus, and Niti Aayog was made in charge for coming out with procurement guidelines for drones as a service. Now, why drones as a service? Why not a product? I will be touching briefly, but I will not really go through the presentation as it is. There are, I think, more than 20 slides. I don't want to waste everybody's time, but I'll just give the gist of it. Any emerging technology, you do not want to be tied to technology because it is evolving. So procuring a service is always better than getting tied to a technology. That's why the focus on procurement of drones as a service. When we focus on the ecosystem, we see a whole, in the drones ecosystem, there are several players. So any regime, any institutional framework for procurement need to address the concerns, issues, and, vision and mission for all these stakeholders. And we all know how the recent years saw a huge liberalization of the regime. So the idea is, how can we leverage this policy regime to scale up the drone ecosystem? In the recent regime, we not only saw regulation on the aspect of operation of drones, but also on manufacturing, promoting services, as well as skilling. I already touched upon this, why drone as a service. And this also really essentially addresses that. We will be sharing this presentation, so I will not go through verbatim with it. Now, when we talk about service being a better way of procurement than product, it almost is like besides not getting remaining technology agnostic, you also have a life cycle kind of a approach where you don't have to